Hello, and welcome to our webinar, Lessons Learned from a Year of Evidence for Action Grant Reviews. Evidence for Action, or E4A, is a national program of the Robert Wood Johnson Foundation based at the Center for Health and Community at the University of California, San Francisco. I am Erin Hagan, the Deputy Director of E4A, and I will be your moderator today. Over the course of the year since E4A launched, we've learned a lot about what sorts of projects are a good fit for our program, as well as what aspects of the LOI development and submission process applicants may need more guidance and clarification about. The purpose of this webinar is to share what we've learned with you and answer questions you have about the program. This presentation will be archived on our website for future review. If you have questions during the presentation, please use the chat feature to ask them, and we will address as many as possible during the Q&A portion of the webinar. We have a lot to get covered, so let's get started. First, I'd like to ask my other two speakers to introduce themselves.
Hi, this is Nancy Adler. I'm the co-director of Evidence for Action.
And this is Maria Gleamore, and I'm the Evidence for Action Associate Director.
Great. Thanks to you both for joining us. Nancy, why don't you kick us off by giving everyone a bit of background about RWJF's Culture of Health vision and the role of research in achieving that vision?
Sure. Thanks, Erin. So the Robert Wood Johnson Foundation describes a culture of health as one that enables everyone to lead a healthier life, both now and for generations to come. It's a culture in which good health and well-being flourish across geographic, demographic, and social sectors. It involves fostering healthy, equitable communities. It guides public and private decision making, and everyone has the opportunity to make choices that lead to healthy lives. Robert Wood Johnson Foundation has developed an action framework to encompass the principles underlying the vision for a culture of health. The action framework guides the Foundation's grant making and its strategic collaborations. So the framework recognizes the interdependence of each action area and the need for collaboration across sectors, both within and beyond traditional healthcare and public health fields, in order to implement the strategies necessary to achieve a culture of health. The action framework serves as a compass to help pinpoint areas where empirical validation is needed. Many questions remain, however, about the components of the framework, how they work to improve health, well-being, and equity, and how they can be modified. And this is where research comes into play. So at the Foundation, within the Research, Evaluation, and Learning arm, RWJF has established 3 pillar programs to develop the evidence base to build a culture of health. So together, these 3 programs, Evidence for Action, Policies for Action, and Systems for Action, support the generation and dissemination of evidence about what strategies work or do not work to improve population health and health equity. Policies for Action is based at Temple University's Beasley School of Law and explores how policies, laws, and other regulatory tools impact public health and well-being. Systems for Action is based at the University of Kentucky College of Public Health, and it focuses on ways to align the healthcare delivery and financing systems to promote health and well-being on a population-wide basis. Both what we call P4A and S4A operate under an open and closed submission process and have established a maximum cap of $250,000 and 24 months for grant awards. The Systems for Action Letter of Intent deadline has already passed for this year, but the Policies for Action call is currently open and is accepting letters of intent through March 25th. Our program, E4A, is the broadest of the 3 programs. We don't have a formal research agenda, and we fund across all areas of the action framework. We operate under a rolling submission process, which means there's no application deadline. We award longer grant periods, up to 30 months, and we don't impose budget caps for our grant requests. So let us tell you a little bit more about the specific parameters of Evidence for Action. And let me turn it over now to Maria to go over the details.
Great. Thanks, Nancy. So Evidence for Action was allocated $6.6 million to award for grant funding through July 2017. And so far we've recommended a bit over $2 million for funding, so that leaves us around $4 million left for the next year and change, year and a half. We don't have an explicit range for allowable budget requests, but it's probably helpful to know that so far we've funded projects with small budgets down to $46,000 and budgets as large as $500,000. And we've invited full proposals from an even larger range, indicating that they were very competitive. So there's really no cap for an allowable budget request, but we do consider what is this potential scientific value of the research proposed against the magnitude of the budget request when we're choosing grants to recommend for funding. We award grants for terms of up to 30 months, and you should really request the amount of funding you need to complete the proposed research project. If you feel that if there's a challenge with the budget, we will work with you to sort of adjust the budget and figure out how to make it work within the parameters. To talk about eligibility, we encourage applications from a wide variety of disciplines and sectors and institutions. There's only the only strict eligibility requirement is that lead application organizations must be public agencies, nonprofit 501c3 organizations, or institutions of higher education, and they have to be based in the United States or in one of the territories. The lead applicant has to meet the listed eligibility requirements, but it's certainly acceptable to partner with other institutions and individuals who don't fit these particular specifications. We also don't require that the principal investigator hold a PhD or other advanced research degree, but the research team really has to have the capacity to complete the proposed research. And so we consider whether somebody has the appropriate expertise for the project. And it's sometimes helpful to know that the PI does not necessarily have to be at the same institution as the lead application. To talk about the application and review process, we have to date received nearly 400 letters of intent since we released our call for proposals in June. And currently about 10% of applicants that submit letters of intent are invited to submit a full proposal. The letter of intent is intended to be relatively brief, and the full proposal expands on that. Once an applicant reaches the full proposal stage, the chances of being recommended for funding are around 35% so far. So the question of how many applicants to invite to submit a full proposal is something that we discuss frequently amongst ourselves, and we are very conscious of the effort and investment that people put into creating a really strong proposal. And so we've currently erred on the side of trying to invite applications for full proposals only if we feel there's a strong likelihood that it will be funded. There is another argument that applicants would potentially prefer the opportunity to make their case at the full proposal stage, even if that likelihood of being funded is relatively small. We actually have talked about the value that we'd really like to hear from potential applicants about which strategy seems more appropriate, weighing offsetting the investment you put in a full proposal and the probability of being funded. So considering that we have a fixed amount of grant funding available to award, if we increase the number of letters of intent invited to the full proposal stage, the percentage of full proposals recommended for funding will consequently decrease. Keeping this dichotomy in mind, we would be grateful if you could just actually vote on the poll that you see on your screen. And there are two options. There's option A, if you support the approach of inviting a small percentage of letters of intent onto the full proposal stage in favor of a greater likelihood that a full proposal will receive funding. Or option B, if you support the approach to invite more letters of intent to the full proposal stage, knowing that that will mean fewer of the full proposals are actually recommended for funding. And I'm going to stop and give people a few seconds to choose the poll, select their option on the poll. Okay, so, oh, people are still responding. I'm going to give people another little bit of time until the numbers stop changing. Okay, I think we have a stable response here. So it looks like, yes, about 84% of people would prefer the strategy of inviting a smaller number of letters of intent to the full proposal stage, and 16% would prefer the alternative strategy of inviting more letters of intent to full proposal with a lower rate of funding. So thank you very much for giving us your feedback on that. It's really valuable to us to hear what is most efficient for applicants. I want to emphasize that regardless of how many applications are advanced to the full proposal stage, our criteria for recommending a proposal for funding really will remain the same. So now let's turn to what are the characteristics of the very competitive proposals that we've seen. And Nancy, I'm going to hand it back to you to talk about that.
Okay, great. And again, thanks to everybody for voting. That's extremely informative to us. So in terms of what evidence for action is looking for, we're looking for rigorously designed quantitative, qualitative, or mixed methods research that expands the evidence base that we need to build the culture of health. Our mission is to support research that will yield convincing findings regarding population health, well-being, and equity impacts of specific policies, programs, and partnerships. So that's pretty broad. So what sort of research is a good fit for E4A? So let me just break down some of those criteria. The evidence that's generated through E4A should aid practitioners and policymakers in setting priorities and allocating resources. And this leads us to primarily target late-stage research that directly tests health outcomes, rather than earlier stage research where people are still developing ideas, developing tools, and testing things out to see whether they're feasible. We're also interested in the development and validation of key measures to improve the assessment of population health, well-being, and equity. And we've dedicated a smaller portfolio of grants to this work. Often this is more maybe at an earlier stage because we really don't have consensually agreed upon robust measures in these key areas. When we consider whether a research project is a good fit, we ask the following questions. Number one, is it rigorous? So this means, is the project designed in such a manner that either positive or null findings will be useful in making decisions? Is there an appropriate comparison group? Can causal direction be determined to a reasonable extent? The second question is it actionable? And this to us means, can people who use your research to make decisions understand it and find it informative? Do decision makers care about this information? Will advocates or decision makers be able to use your results right away? We're less interested in things that would conclude more research is needed, and more interested in things that really do have a component that can be used right away for action. The third question we ask is whether it's relevant to building a culture of health. Does it relate to overall population health, well-being, and health equity? Are you investigating possible connections between or among sectors, or exploring the integration of health considerations outside the traditional healthcare setting? When you're describing the relevance of your research in a letter of intent, you should primarily focus on why your research is important, as opposed to an extensive explanation about why the issue is important. An initial framing of why the issue is important is helpful, but we really want to know what is your research going to add to that. The fourth question we ask is it novel? Does your study contribute to an existing body of evidence in terms of it being incremental or really something particularly new? Or will it fill in gaps in our knowledge about how to improve population health, well-being, and health equity? As we mentioned, we've reviewed nearly 400 letters of intent, And Erin has read every one of them. So Erin, I'm going to turn it back to you to describe some tips for writing a competitive letter of intent and share some insights about common reasons that they're turned down.
Thanks, Nancy. Yes, we have received and reviewed a lot of LOIs, which has helped us refine our thinking about what sorts of research are good fits for the program, as well as recognize the areas in which applicants could use more guidance. So first off, I want to stress the importance of following the LOI narrative template in the application and review system. The most successful LOIs directly answer the questions included in the template and adhere pretty closely to the suggested length for each section. So that's about half a page for your rationale, a page for the description of the research approach, and about a paragraph description of the research team. The research approach is really the most important component of the LOI narrative. While we recognize that you won't be able to describe the approach in great detail in only 2 pages, it should be evident that the methodology is appropriate and rigorous. As Nancy mentioned, that means you need to clearly articulate a research question or questions and specify a methodology for analysis, your plans for data collection. List the outcome measures that will be assessed, which must include health outcomes. Describe the study setting and population as well as an appropriate comparison group, and summarize the anticipated use of results. Note that citations are not required at the LOI stage. The description of your team should really be used to highlight expertise or relationships that may not be apparent due to the limit on the number of CVs you may submit at the LOI stage. So for example, you may want to mention the cumulative experience of your team in conducting the type of research you're proposing, or describe a unique multi-sector collaboration you have established. RWJF has a strict policy against providing proactive individual feedback about applications that are turned down. This makes sense when you consider how many applications the Foundation is reviewing, but we know this can be frustrating for applicants. In our reviews, we've recognized some common characteristics among applications that are turned down, which we want to share with you today. So sometimes there is a lack of a clear research question, or the question is not well articulated. If we can't tell what question you're trying to answer, it's unlikely we'll invite you to submit a full proposal. And LOIs that are requesting programmatic development or implementation funding don't make it past our screening phase. This really is a research program. If you can't answer yes to the questions that Nancy posed relating to rigor and actionability, it's probably not a good fit for E4A. We're not likely to fund research in which the only conclusion is the need for more research. Whether or not your outcomes would be actionable is often related to the stage of your research, and we've determined that our niche is primarily in funding late-stage research that directly tests the health outcomes of an intervention. While we recognize the need for research at earlier stages, we've decided that this is where our funding can be most impactful. So for example, if you're doing research to inform the development of an intervention, that's probably too early for us. But if you're at the stage where you're ready to look at the impact of that intervention, that's the right spot for evidence for action. Another common problem is inadequate health outcome measures. We certainly allow the inclusion of non-health measures as well, but data must be collected on health outcomes too. This includes mental, emotional, behavioral, and physical health. Appropriate measures aren't limited to biomarkers. It could include self-reported health, vaccination records, emergency room visits, treatment adherence, etc. Those are just a few examples. And data could be gathered from either primary or secondary sources. Finally, there needs to be evidence of or a reasonable expectation that the intervention and policies you are researching will be scalable and broadly applicable to population health. This means the intervention needs to be sustainable and transferable across populations and settings. These requirements are mutually inclusive. So letters that are turned down may only be missing one of these components, but research that is a good fit with evidence for action meets all of the criteria we've described. For example, you must propose research that is both at the appropriate stage and level of rigor so as to provide information that decision makers can use almost immediately to set priorities and allocate resources that will improve population health and equity in the most efficient and effective manner. We're excited to have awarded our first 4 grants in the last month, and these projects serve as examples of the type of research that is a good fit for evidence for action. So I just want to take a moment to quickly touch on the projects we funded so far, and I encourage you to check out the Grantees page of our website to learn more about these projects and new grantees that we're bringing on. So first we have the EARN Health Trial, Intervening on Economic Determinants of Health. The research team from Stanford is evaluating a matched individual development account intervention among low-income adults to see if improved financial security impacts mental health and health behaviors. The Helping Smokers Quit project team out of George Washington University is analyzing the relationship of state tobacco use cessation efforts, other tobacco policies, and individual characteristics on the smoking and quitting behavior of Medicaid smokers. The PE litigation project from the University of California, Berkeley is conducting a qualitative study to assess the impact of a recent lawsuit against 37 non-physical education compliant school districts in California, with a particular eye for possible unintended consequences of the litigation. And the Multiple Chronic Conditions and Population Health Research team out of the University of Wisconsin is examining the use of multiple chronic conditions data as an indicator of individual and population health, functioning, and well-being, and assessing whether this data can be used to establish metrics that will assist in evaluating changing patterns in population health over time. So now we're going to go ahead and be able to open it up for questions. If you haven't already, please chat your questions to us via the chat function. Keep in mind that we're not in this venue able to answer questions about specific applications and research projects. But if you do have specific questions about your proposal, we will share contact information at the end, and you're welcome to reach out to us directly. Our other co-director, David Vlahov, is also going to be joining us for the question and answer portion. I'm not sure if he's been able to join us yet, although I know he will be shortly. David, are you here yet?
Yeah, I just came in. Thank you.
Excellent. Welcome to the webinar. So why don't we go ahead and just dive into the questions. The first question we have, Nancy, is for you, and it's, who will review my proposal?
Sure. Thank you, Erin. Actually, it gets a lot of eyes. At the LOI stage, it will be reviewed by the National Program Office team, those of us who are on this call, along with our colleague Laura Gottlieb, who couldn't join us today, and also colleagues at RWJF, Claire Gibbons and Tracy Costigan. At the full proposal stage, we'll also solicit an external review from a content or methodological expert in the field, and at least one additional reviewer from the Foundation.
Thanks, Nancy. David, why don't we get you into the mix right away? So we have a question about, do you allow community-based participatory research?
The answer to that is yes, we do. We would like to make sure, though, that people consider rigor in the design of the evaluation of a program, and that it's actionable, and probably good to have the academic side bring the research component to it. But we definitely like to see links between community and researchers.
Excellent. Thanks so much. And one thing I'll just quickly add to your response as well is that we know that the process of building relationships, conducting needs assessments, identifying research questions can take a lot of time. And so the best bet for proposing a CBPR study to evidence for action is to have actually gone through that process and be at the stage where you've already identified your research questions so that you can clearly articulate that information in your LOI. So Maria, the next question is, will projects be considered for funding if the duration of the study exceeds 30 months?
Well, we do recognize that a 30-month project duration could impact the type of studies that people can undertake that are feasible. And we really encourage applicants to consider creative ways for achieving high impact research within the duration and budget parameters of the program. One option, for example, is breaking research into phases, using funding to supplement on existing projects, really leveraging funding from multiple sources, using existing data sources to do high impact research, taking advantage of natural experiments and other kinds of settings. So we encourage you to reach out to us to discuss ideas for research that you think that are very high impact projects but you think might fall outside of the 30-month parameters, and we can talk about strategies for helping it fit within the constraints of the Evidence for Action program.
Thanks, Maria. A similar question about duration and budgets is whether or not the budget request is per year or for the whole grant period, and how specific or accurate it needs to be. So the budget request should cover the entire grant period, and at the LOI stage you only need to provide an approximate dollar amount, which you should just round up to the nearest 100 at the LOI stage as opposed to estimating an exact dollar. So if you think that you need $324,422, just ask for $325,000 at the LOI stage. If you're invited to the full proposal, you'll be required to provide a detailed budget request and justification. And I should just mention that we do award grants up to 30 months, but certainly you can request a shorter duration if necessary. So the next question, let's turn back to you, Nancy, for this one. It's a great question. Have you considered referring projects to program officers for other funding opportunities within the foundation?
Yeah, absolutely. Actually, our colleagues in the foundation frequently share proposals with the other RWJF programs, and to see, especially when we think the research may be a better fit elsewhere. We can't guarantee that people will receive funding from other programs, and given that E4A is a rolling program and most other programs operate under an open and closed submission process, the timing and logistics for coordinating this can be a little complicated at times. But we try to, if we think it's a worthwhile proposal and doesn't fit with us, we hope that we could find another home for it. An application to one RWJF program does not preclude you from applying to other programs. So we also encourage people to sign up to receive funding alerts from the RWJF website.
Great, thanks. So we have a question about, you mentioned that you do accept qualitative research. Can you be more specific or talk about the sort of qualitative research that is appropriate for Evidence for Action? Maria, do you want to take that one?
Sure. We don't have a really narrow definition of what is ruled in or ruled out, but there are really some approaches that are not as well suited for a 30-month time frame or that are not likely to directly inform action based on that time frame. I would say that in general we are more enthusiastic about the fit of qualitative methodologies if there's really already strong quantitative studies that the qualitative work will help understand and guide next steps. For example, qualitative inquiry can help explain why an intervention that had really shown very promising results is not yielding anticipated impacts in a new setting. We also tend to be more enthusiastic about qualitative inquiry that's embedded in a quantitative or mixed methods approach. So really bridging approaches to make the strongest argument for particular action strategies is most compelling.
Thanks. So the next question is, if we received a turn down on our LOI, would it be more advisable to tighten based on what we've learned today because there were so many competing proposals, or is it better to change the nature of the project altogether? David, can you respond to that? You might be on mute.
Yes. you submit a letter of intent, and when a review comes back and you feel that your research fits within the scope of the Evidence for Action funding, and you see that you were turned down for issues that you can address, such as by more clearly articulating your research question and methods, strengthening your research design, selecting better health outcome measures, partnering with another researcher or institution, those kinds of things, then feel free to revise your letter and submit again. But if after today's presentation you feel that it's more likely that the research you initially proposed is not a good fit for Evidence for Action, then at that point you may need to change the nature of the project.
Great. That sounds good. So one of the questions we've gotten, and I know that other programs have gotten this question too, is how is this grant different from Policies for Action or Systems for Action, and how can we find out which one to apply for? So I think that Policies for Action is most relevant right now since their call for proposals is also open. Nancy certainly spent some time describing the primary differences among the programs earlier, but we do recognize that there's a lot of overlap and it can be confusing to determine which program is the right fit for your research. So some of the basic tips to help you decide whether to apply to P for A or E for A. If your research is clearly related to the implementation of laws or policies, you should apply to Policies for Action. If the Policies for Action call for proposals is closed, which will be the case after March 15th, you can apply to Evidence for Action. If you need more than 24 months or $250,000 to complete your research, you should apply to Evidence for Action. And if you apply to Policies for Action and get turned down because your project wasn't a good fit, then you might consider applying to Evidence for Action. But all the programs have the same standard for rigor, so if you get turned down because your design wasn't rigorous, your proposal probably won't be competitive with Evidence for Action or Systems for Action either. You can also feel free to contact our office or any of the offices directly to discuss whether the project is a good fit or not. And I did notice that there was another similar question about how much contact is reasonable between applicants and the program offices. And we, particularly at least at Evidence for Action, have tried to have as open door policy as possible. We can't design your research project for you, and we don't respond to written, we don't review written drafts of letters of intent in advance, partially because of the sheer number of applications that we receive. But we do have phone conversations or in-person conversations frequently and are absolutely willing to do so on an ongoing basis. And so you should feel free to reach out to us with questions about either logistical or content-based submission questions. So Nancy, there are some questions about our characterization of later stage versus early stage research. And so one person has asked, what if we are able to conduct early stage research in a rigorous manner? Then would it be competitive? Can you speak to that a little bit?
Yeah, I mean, it's always hard in the abstract to say because it depends a lot on the specifics. But what we're meaning by early stage research is research that really won't tell us does whatever the intervention or policy is work to change health. It's much more, it tends to be more formative in testing earlier parts. And you can do that in a very rigorous way, but it still would not fit under E for A. And so, again, we've determined, given the number of really good ideas we've gotten across the board, that our most appropriate spot is in the later stage research that can directly test health outcomes, and that's an impactful niche for E for A to fill.
Thanks. So David, I'm going to turn back to you. The question is, are you interested in an application that primarily focuses on the development of an intervention with maybe some pilot testing components?
I think we have to go back to what Evidence for Action funding is about. It's dedicated to research projects. It's not for intervention program development and implementation. So evaluations of implementation of programs or policies, they're appropriate as long as the majority of that funding is used for research-related activities. You may want to consider finding funding for initial program development and implementation elsewhere, and then applying to evidence for action for supplemental funding to evaluate the health impacts of the program.
Great, thanks. Maria, this is a pretty straightforward question, but is it okay to propose a secondary data analysis study?
Yes. Secondary data analyses can be very efficient and very effective uses of funds if they really have the potential to provide new insights into health impacts. And often there are existing data sources that can be very powerfully used that people really haven't taken advantage of to address the kind of key culture of health questions that we are interested in.
Great. So, there's another question almost identical to the one that David just answered, but maybe maybe Maria, if you answer it, it will resonate a little bit differently. So, can grant funds be used for services or program implementation?
I think that David's phrasing was great. That really and this is one of the most challenging pieces, I think, is that the focus of evidence for action is around research and is around providing evidence that will guide activities in a sort of generalizable sense. So evaluation of implementations of programs or policies is appropriate as long as most of the funding is going to go towards research-related activities. And I think this is challenging because there's so many fabulous interventions that are programmatic needs, but that is not the focus of evidence for action. And there is more information on the website that we encourage people to look at, because I think this has been one of the big concerns for applicants.
Yep, thank you. So Nancy, can you talk a little bit about whether or not applicants need to have baseline data, and if not having it might be a disadvantage to their proposal?
Well, we don't require baseline data or specific preliminary data for the proposal, but ideally you'd either have a plan to collect it as a component, or in the absence of baseline data would certainly want to know that there's a reasonable basis for thinking that whatever it is you're proposing to evaluate its impact actually is feasible and workable. So a total lack of baseline data would be considered a limitation of the project, because it may be hard for us to determine whether it's promising enough to have an impact. So again, it's not absolutely required. It certainly provides better evidence, but if you can provide a very compelling rationale, we wouldn't rule it out.
Great, thanks. So I just got a question about how many grants we're planning to award. So the number of grants we will award is really dependent on the budget requests of the successful projects. Maria touched on this earlier, but the budget range for grants we have awarded so far is really wide, between $46,000 and $500,000. So it's hard to predict a specific number of awards, and we don't have a set target of grants to award. David, this question I think if you could address would be great. So for such a broad possible area like a culture of health, especially with an investigator-initiated LOI, can you tell us if you favor certain subdisciplines, outcome categories, exposures, something within public health or the medicine clinical sciences? Do we really have any sort of target areas we're looking at?
And the answer to that is no. We're looking, I think, for diversity of disciplines and perspectives, really as investigator-initiated, to really put the net out there as broadly as possible. And so we're not favoring subdisciplines or exposures and risk factors. I think what we do favor is research that will be relevant for improving broader population health and equity. So we're really looking for research that includes strong, appropriate, and validated health outcome measures. That's going to be key but it's also what are the disciplines, what are the perspectives that come towards creating that culture of health, linking to that have health outcomes, and thinking about the research as being actionable.
Great, thank you. So I just got a question about the lead investigator. Our organization's lead investigator is not published and has lower years of experience conducting this work. So will this result in a lower chance at being awarded a grant even if we plan to collaborate with academic experts within various fields? Maria, can you speak to that?
Sure. We really try to consider the capacity of the entire team to complete the proposed research. We don't just focus on the qualifications or experience of the principal investigator alone. So if you're a new investigator, we encourage you to talk about how the team as a whole has the expertise to field the research successfully.
Great, thanks. So another some kind of basic questions that we've gotten in that I should speak to quickly. So one is, and I think a little bit similar to the question that Maria just got, but about the applicant organization, do you award funding to newly developed nonprofits? So sure, as long as you have a 501c3 classification, you're a government entity or an institute of higher education, you are an eligible applicant. And then there's another question that I did mention just quickly in a slide earlier, but someone was asking for clarification about whether or not references are included in the LOI total page count. So we actually recommend that you not include references at the letter of intent stage. They're not required, and they will count towards the 2-page limit for submission if you do include them. All right, so we just got another question about the budget. A good question about how do you take budget into account and how does budget affect evaluation? And I think that of the proposal, and I think this is important because it comes into account differently depending on the stage. So it comes into account differently at the LOI and full proposal stage. So Nancy, could you speak a little bit to the ways that we consider the budget at those 2 stages?
Sure. You know, as Erin said, we've funded a wide range from $46,000 to $500,000, and it depends really on the scope of the project and the importance of the issue. So we're affected by the budget. We don't consider it a specific criterion, but a very, a more expensive project has an opportunity cost of others that we can't fund. So obviously a $400,000 project has to have the impact of 2 $200,000 projects. So we take it into account as we're evaluating not only is this a good idea, but is the resources needed to evaluate it commensurate with how important the idea is. For those that advance on to the full proposal, then the budget is looked at more carefully in terms of whether it's appropriate, also whether it's feasible. You don't want to err on the side also of under budgeting and proposing to do way more than is humanly possible with those funds. So at that point we'll look at whether the budget is appropriate for what's being proposed.
Great, thanks. Hopefully that's helpful to people. So I got a question about whether or not we could share an LOI that was selective for the next stage, for the full proposal stage. So unfortunately we cannot share letters of intent or full proposals. Those are confidential and the property of the applicant. So we're not able to share those proposals. So the next question is, do projects have to be national in scope, or can they be focused on a state? David, can you speak to that?
Yeah, I think it really goes back to the research question and the design, and then what is the most appropriate sample to be able to address the question and meet the aims of the study. So in some cases that may be national, in some cases that may be state, and in others it may be communities. And again, we're looking at what is the most appropriate. And, you have to think about such issues as generalizability, but it's making the case for that. So no, not restricted to just one perspective.
Great, thank you. So the next question is, do health outcomes also include access and utilization? Nancy, can you speak to that?
Yeah, access and utilization they can be included, but we really want to know that it's impacting an actual health outcome. So access itself, if that's the only outcome, that would not be considered sufficient. Utilization, probably not, unless somehow utilization could be directly inferred to be related to improved health.
Sure, great. Maria, can you answer the question, can a project target a specific population, like women experiencing violence or substance using adolescents?
Yes, the answer is in general it's fine and often essential to focus on a particular population. The thing to make sure that you argue in your letter of intent and full proposal is how the understanding from that population is relevant more broadly, and the population health importance of that population. And keeping in mind that we have a pretty critical emphasis on equity and addressing health inequalities. And so framing a particular population focus with respect to the importance of the impact on population health and population health inequalities will make it more compelling.
Great, thanks. So David, to follow up on the previous question, someone also is asking about international comparative studies or whether or not research should focus on U.S. populations. Can you respond to that?
Yeah, the Foundation has a focus on what's happening in the United States. So we're really looking at what's happening in the United States.
Thanks. And Nancy, there's a question about whether proposals can address mental or behavioral health issues. Can you speak to that?
Absolutely. Yeah, no, the answer is yes. I mean, we really define health broadly to include mental health and well-being. I think we're less clear about what the measures will be, particularly of well-being, because I think that's a new area. But we would be very interested in outcomes that have that wide scope.
Great. So someone mentioned reasonably that we indicated that 501c3s, academic institutions, government entities are all eligible to be grantees, but most of the grants we've awarded so far are university-based. And so there's a question about what type of nonprofits have we funded. So the grants that we mentioned are the 4 that have been awarded to date. We've recommended others for funding. And just to give you a sense that in these cases, these 4 are university-based lead applicants. But that doesn't always mean that the entire team is comprised only of university-based academic researchers. We do have other examples of future likely grantees that are based in government entities or are collaborating with community-based organizations. And so certainly all are eligible. I will say, to echo Maria's point earlier, that as a rigorous research program, and I think David mentioned as well, often the type of letter of intent that is going to be most successful is able to speak to the rigor and to the design of the research. So frequently the most successful letters of intent are drafted by people either in academic settings or researchers who are familiar with applying for research grants. But that process really can be collaborative, and again, the lead applicant and the principal investigator do not need to be from a university, although clearly so far all of our grantees have been, lead applicants have been based at universities. So Nancy, I know you did just speak to this, but someone is asking if you can give a little bit more specificity about what are the health outcomes we're examples of health outcomes we would be particularly interested in all of these kind of ranges of mental health, behavioral, other indicators that may be precursors of disease, for example?
Well, I can't give examples of specific measures because I think that gets too specific. It really depends on what the question is and what outcome it ought to affect. So one of the proposals that is funded is, for example, looking at patterns of chronic diseases, not just counts, but are there different ways of clustering those? I think we're really interested in trying to actually develop some better sort of summative measures of the health of an overall population. But we still are very open to more specific health outcomes that will obviously are an important component of population health. So I would say, particularly health outcomes that affect a large number of people and are, clearly impacted by the proposed intervention would be favorably reviewed.
Great. Maria, can you speak to whether or not we're interested in cost-benefit analyses, and particularly in regard to changing policies within a state that target youth and community health outcomes?
So our primary interests are around health impacts, but we also recognize that for change to happen, it's really important to include evidence that is compelling to decision makers. And so to the extent that the research really will produce evidence that moves, that motivates people to adopt a policy, change a system, we are enthusiastic about that kind of analysis. So the key is for the particular research question, which has to be likely to really impact population health, what are the key outcomes, or what's the kind of most appropriate analysis for the science at that stage? So in theory, yes.
Great, thank you. David, maybe you can address this next question. Would you say your interest in researching policies for health outcomes is more focused on the efficacy of various possible policies, or expanding our understanding of how the adoption of policies can be measured and understood?
I mean, both are important questions, but I would really look at what's the evidence for action, and really looking at the efficacy is an important element of that. So that's, I think, where I would put the emphasis in developing proposals.
Great, thanks. So we got a question about what role the Culture of Health Action Framework should play in the LOI proposal and in the research. The action framework really serves as kind of a compass or a guiding point. It's particularly useful for us as we're thinking about what research is a good fit for evidence for action. You're not required to indicate a particular action area that your research falls into, or to use the measures that have been identified as components of the action framework. And the foundation really is still developing that framework, and so in the sense that it might stimulate new thinking about how to achieve a culture of health and new research needs, I think it's a great jumping off point. But certainly is not intended to be a prescriptive guide for developing your research. Nancy or David or Maria, do any of you want to add anything to that thinking?
No, I think you've said it well.
Yeah.
Thanks. Well, while we're on this point, though, one of the questions is, how long do you expect the E4A program to be around? So I will say that to Maria's earlier point, we have been allocated our initial funding through July of 2017, and certainly our grants will last past that date. But Nancy, do you have other thoughts about the Evidence for Action program longevity?
My thoughts are that I hope it lives a long time. We, I think our interest is in, we've been basically told that if we're getting lots of good applications and funding important studies and they're showing good results, there's no reason why it wouldn't continue, but we have no guarantees.
Of course. So I think I'm going to take this last question, and then we're really getting close to our time. And I have a couple of closing remarks for people. So the last question is, or actually there are a number of questions again about feedback at the letter of intent stage, particularly if you have received a turndown. So again, this is a foundation policy across all of their programs that they do not provide proactive feedback at the or at the turndown stage of any of the stages actually. However, you are welcome to reach out directly to the program office if you have specific questions about why your application has been turned down. So I do want to take a moment then to share with you the ways to get in touch with us if you need to or would like to do that. So obviously there are a variety of mechanisms. We'll be posting an archived version of this webinar on our website if you missed anything or if you want to share it with your colleagues or review it. I especially encourage you to check out the frequently asked questions section of our website, which includes a number of the responses that we shared today as well as other pertinent information about applying for our grants. You can follow us on social media at Twitter or on LinkedIn. Our Twitter handle at COHERE stands for Culture of Health Investigator Initiated Research. I know it's a little funky, but that's where we are if you'd like to follow us there. You can also sign up for our e-newsletter or simply shoot us an email if you'd like. So I just want to thank you all for joining us today. We hope that you found this presentation to be informative and helpful, and we look forward to working with you in the future.